So about 2.5 years ago, we were aware that we'd gone halfway down a journey of moving to digital dictation with just handheld dictaphones. And we still had a lot of people using tape dictaphones, analog dictaphones that were unencrypted, insecure, were being lost occasionally, nothing too concerning, but we wanted to start taking a more structured approach to it. And we'd come to hear about BigHand because of their success with Northumberland Tyne and Wear, who I knew the CIO up there and the CCIO as a national profile, and he talked very persuasively about how we've just got on and done this, and it sounded like a really positive message. So we started doing that, started implementing it about 18 months ago, and we're still on the journey. I think we're only getting near to the end of the beginning of our journey with BigHand. So digital dictation is the core of it. So we wanted to get our doctors able to dictate using their mobile phones so that could be immediately picked up and processed by the secretaries. And that's been really well received. Speech recognition as a back-end solution to aid the secretary's work and to improve turnaround times we put in as well. And we're also looking at front-end speech recognition as well. So we're looking across the range of voice products and learning more about the task management and the BigHand Now product. So I think that's probably another area that we'll be looking at over the coming year. Well, so far we've been able to get a much clearer view on what secretaries are doing in terms of audio transcription, been able to get a view on the volume of work that's being done, the time of work that's being done, where previously this was just all, unseen. Being able to see those people who have different working practices, either dictating in the evenings or at the weekends, and start working with them to understand what the pressures are that are causing them to do that. I think one of the advantages is just being able to see the volume of demand. So previously you'd have to, maybe look at a pile of tapes on a desk and say, well, this seems to be a busy team, whereas now you can see in minutes and hours how much dictation there is. If there's a backlog building, then our office managers are able to respond to that quite quickly and move jobs around or move staff around as it's required. I think that, as I say, we're still probably at the end of the beginning, but we're starting to see the benefits of being able to do that. I think BigHand, the culture of the organisation seems to fit quite well with us in that they're trying to improve and innovate, which is something that we've got a big programme of doing, continuous quality improvement. We don't want to stay still. We don't want to look back and say, what did we do for the last 5 years?